Assalamualaikum warahmatullahi wabarakatuh. My name is Shofia Muthiawati and I will present Chapter 1 Introduction. In this chapter, we will discuss about background of the research questions, purpose of the research, significance of the research, scope of the research, and clarification of the key terms. The first is background of the research. Nowadays, mental health often becomes a discussion. Mental health is very influential on physical health. For example, gastric ailments. Many people do not aware the influence of psychological condition on gastric health. One of the gastric disease commonly found in the society is GERD or gastroesophageal reflux disease, or commonly referred to as acid reflux disease. Gastric acid disease or gastroesophageal reflux disease or GERD is a pathological condition as a result of the reflux of stomach contents into the esophagus with a variety of symptoms that arise due to the involvement of the esophagus, pharynx, larynx, and airway. Symptoms commonly caused by GERD are discomfort in the epigastric section, or commonly called burning sensation or heartburn, sometimes mixed with dysphagia or difficulty swallowing, nausea, and bitter taste in the tongue. Certain stressful life events have been associated with the onset or symptom exacerbation in other common chronic disorders of the digestive system, such as functional gastrointestinal disorder or FGD, inflammatory bowel disease or IBD, and gastroesophageal reflux disease or GERD. Second is research questions. The main questions to be addressed in this research are: how can psychological conditions such as stress influence the physical condition? What is adolescent? What is GERD? And what is the relationship between GERD and stress? Third is purpose of the research. According to the research questions, this research aims to analyze the influence of stress on physical condition, the definition of adolescent, the definition of GERD, the risk and the symptoms associated with GERD, and the relationship between GERD and stress. Fourth is significance of the research. The findings of this research is expected to be able to provide distinct information about the influence of psychological condition on gastric acid disease in adolescents to the wider society, so that people can pay attention to mental condition in order that the gastric acid disease relapse less frequently in adolescents. Practically, these findings of this research are expected to give information on how to identify the relationship between psychological condition in adolescents and physical condition, especially the relationship between GERD and stress in adolescents. Professionally, the findings can inform doctors that psychological condition can cause some of disease. Fifth is scope of the research. The research is limited to analyze the relationship between GERD and stress in adolescents and how stress can influence gastric acid production, which cause GERD. And the last, clarification of the key terms. To avoid misconception, several terms are clarified as follows. There are stress, gastric acid, adolescence, GERD or gastroesophageal reflux disease, and LES or lower esophageal sphincter. That's all from me. Thanks.
My name is Aurelia. I will explain the chapter 2 about stress, adolescence, and stress. One of psychological problem is stress. According to Dyer, stress is defined by psychologists as body's reaction to a change that requires a physical, mental, or emotional adjustment or response. Things that cause us stress are called stressors. It comes in all shapes and sizes. Even our thought can cause us stress and make the human body more susceptible to illness. The relationship between stress and illness is complex. The susceptibility to stress varies from person to person. An event that causes an illness in a person may not cause illness in other person. Research shows that almost every system in the body can be influenced by chronic stress. When chronic stress goes unreleased, It suppresses the body's immune system and ultimately manifests as illness. Adolescence is a population group aged 10 to 19 years. Growth and development during adolescence is divided into three stages, namely early adolescence aged 11 to 14 years, mid-teens aged 14 and 17, and late teens aged 17 to 20 years. In 1904, American psychologist G. Stanley Hall wrote the first scientific book on the nature of adolescence. G. Stanley Hall explores the issues of upheaval and stress. Hall said that adolescence is time of upheaval filled with conflict and created of mood where thoughts, feelings, and action move in the range between arrogance and humility, kindness, and temptation, as well as joy and sadness. Teenagers may be naughty today, fierce at one time, and kind at the next. Or maybe they want to be alone, but a few seconds later, they want to be with their best friend. And then I will explain the GERD. GERD is gastroesophageal reflux disease. It's a very common digestive disorder worldwide. According to the Montreal definition, GERD is a condition of troublesome symptoms and complications that result from the reflux of stomach contents into the esophagus. Diagnosis of GERD is typically based on classic symptoms and response to acid suppression after an empiric trial. Gastroesophageal reflux is primarily a disorder of the lower esophageal sphincter, but there are several factors that may contribute to its development. The factors influencing GERD are both physiologic and pathologic. The classic and most common symptom of GERD is heartburn. Heartburn is a burning sensation in the chest, radiating toward the mouth as a result of acid reflux into the esophagus. However, only a small percentage of reflux events are symptomatic. Heartburn is also often associated with a sour taste in the back of the mouth with or without regurgitation of the refluxes. Notably, GERD is a common cause of non-cardiac chest pain. It is important to distinguish between the underlying cause of the chest pain because of the potentially serious implication of cardiac chest pain, and various diagnosis and treatment algorithms based on etiology. A good clinical history may elicit GERD symptoms in a patient with non-cardiac chest pain, pointing to GERD as a potential etiology. Although classic symptoms of GERD are easily recognized, extraesophageal manifestations of GERD are also common but not always recognized. Extraesophageal symptoms are more likely due to reflux into the larynx, resulting in throat clearing and hoarseness. It is not uncommon for patients with GERD to complain of a feeling of fullness or a lump in the back of their throat, referred to as glabus sensation. Furthermore, acid reflux may trigger bronchial spasm, which can exacerbate underlying asthma, thereby leading to cough, dyspnea, and wheezing. Some GERD patients may also experience the chronic nausea and vomiting.
Assalamualaikum warahmatullahi wabarakatuh. My name is Salma. I want to present literature review about relationships between stress. Stress can cause anxiety that is closely related to lifestyle. Anxiety disorders can result in a variety of physiological responses, including digestive disorders. Gastric acid production will increase under stress. Increased stomach acid level can irritate the gastric mucosa and, if left for a long time, can cause gastritis. Patients who experience stress often experience disorders of the digestive system. For example, the stomach often feels bloated, nausea, and pain. disease caused by excess stomach acid known as gastritis. Oregon's research in 2003 shows that patients who experience gastritis are related to the stress they experience. Psychological and emotional factors such as anxiety and depression can affect the functioning of the digestive tract, resulting in changes in gastric acid secretion, affect motility and vascularity of the gastric mucosa, and reduce the threshold for excitatory pain. Stressful life events have been linked to onset or exacerbation symptoms in other common chronic disorders of the digestive system, such as functional digestive disorders or FGD, inflammatory bowel disease or IBD, and gastroesophageal reflux disease or GERD. Occurs are caused by excessive stomach acid, and studies in patients with gastric fistula have shown that anger and hostility increase gastric acidity, while depression and withdrawal reduce it. Thank you.
My name is Desy Lianti. I will explain Chapter 3. 3.1 Research Design. The approach used in this research is experimental research. Experimental research is research carried out by manipulation that aims to determine the effect of manipulation on observed individual behavior. Manipulation can be in the form of certain situation or action given to individuals or group, and after that the effect can be seen. The research method used in this study used quantitative research method experiment, which in the process has the aim to determine the effect of a particular treatment, as well as to test the hypothesis set by the researcher. To test the hypothesis, research needs to identify the variables that are focus of this study. 3.2 Site and participants. To make it easier to obtain data in this study, the authors need a data source. According to Control, what is meant by the source of data in this study is the subject of where the data obtained through literature review and field research. In this experimental study, using subjects from POLTEKKES students with GERD with a total of 12 people with an average age of 17 until 20 years, which were divided into two groups. Namely, the first group is control group and the second group is experimental group.
I'm Hamidah, and I will present about data collection technique and data analysis. Data collection technique. To obtain valid data in research, it's necessary to determine the appropriate data collection techniques. Data collection method is an important part in the research process because the data collected can describe the actual condition of the research subject. This aims to reveal the fact about the variable studied. Treatment carried out by researchers and assisted by several colleagues. 2 treatments were carried out on the research subject to clearly determine the effect of the study. To find out how basic condition affects stomach acid disease or GERD, an experiment was conducted. GERD sufferers are stressed until the disease recurs. The first condition is that when a recurrence occurs, the subject is made even more stressed. Then, the second condition, the subject is made to better control stress. Data analysis. In accordance with the type of research and the type of data, the analysis used in this experimental study is a quantitative analysis using statistical formulas, which includes description of trends, comparison of different groups or relationships,
between variables, as well as interpreting comparisons between research results and those predicted before research. The purpose of using this analysis method is to simplify the data into the research objectives. In this quantitative analysis, the researcher will then analyze the data that has been collected. The purpose of using this analysis method is to simplify the data into the research objectives. In this quantitative analysis, the researcher will then analyze the data that has been collected.